Decompression of the knee joint as a part of the therapy, osteoarthritis or tendinitis, requires work by the therapist to help the patient. Equally important part of this process is what patients do at home between the sessions to help therapists achieve stable clinical results as soon as possible. This video will cover homework for the patients between the sessions. My name is Dr. Rostor Chininov. I'm founder of Science of Massage Institute located in Phoenix, Arizona. As I said, in this short video, we will discuss homework for the patients, what they need to do between the sessions conducted by the therapist. Why it's so important? There is a lot of surgeries done for the knee replacement, which can be prevented if proper treatment was done on early stages. So early stages of the compression of the knee joint actually prevent further surgery while we getting older and our joints start to deteriorate. From that perspective, it has two equally important components: medical massage protocols to decompress soft tissue around the knee joint to take pressure from the joint itself, and secondarily, what patients do between the sessions. And that two equally important parts allows therapists quickly, efficiently decompress knee joint, and that it is patient job to maintain it and prevent further degeneration of the cartilage. The knee joint is a very simple joint. It does only two motions: flexion and extension. This is why stretching of the knee joint by the patient is a relatively simple task. But we will discuss how to do it correctly to get as much as possible benefit from this very simple flexion extension stretch of the knee joint. Last week in our clinic we finished patient, a young guy who was barely able to walk, and he limped horribly on the right side because he strained his hamstring muscles during the physical activity. Proper treatment and his dedication to the support allows us in 3 sessions eliminate horrible limp and bring him back to the normal gait. And you can see right now in the video that he has very slight residual delay, which we will finish this week and fully restore the function. So from that perspective, the cooperation between the therapist and the patient is foundation for the clinical solution. What we'll do right now, I will ask our director of service, Julia Truchininov, and she helped me to demonstrate you very simple set of stretches which you should demonstrate to the patient. An idea of this video that you give link to the patient and patient follow recommendation what we discuss right now. Here is the starting position. It can be done on the floor or on the hard surface, and you ask patient to make a loop from the belt or from the piece of old sheet, and the loop needs to be placed under the base of the toes, not on the toes, not on the arches, but at the base of the toes. Now, entire stretch comes from the body weight. What we'll ask Julia to inhale, slowly exhale through the mouth, and first she pulls to herself, and then she raises her leg to stretch hamstring muscle. When she needs air, she lowers that, she inhales, and again use her body weight to lift the leg while she stretches with dorsiflexion. And that decompresses posterior aspect of the knee, and specifically hamstring muscles and leg muscles, which also control pressure within the knee joint. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you, and see you in the future. Now we will use flexion to stretch quadriceps, and there is 2 ways to do that. If the patient older and it's difficult for them to maintain balance, it can be done on the chair. What you can see here, Julia keep her knee out of the edge with the pillow under the knee, and it's critically important that the right leg need to be all the way forward on the level of the knee. Now what you ask patient to inhale quickly, slowly exhale and sit on carefully on the left knee to the level of discomfort. Do not overstretch. It's better to understretch than overstretch and create compensatory reaction. Again, inhale and she just sit there waiting until all air is gone. If a patient is flexible and to get more benefit from the stretch, it can be done against the wall. So Julia leans against the wall with her right shoulder and she grabs her ankle joint, and the leg needs to be on one line with the body. What she does right now, she inhales, and when she exhales, she uses her left for the flexion, only using power of the arm. It allows to decompress quadriceps. Again, inhale, slow exhalation, and that's the stretch for the flexion. Each stretch, hamstring muscles, which is extension, and quadriceps with the flexion, needs to be done 5 times during long exhalation. It can be against the wall or it can be on the chair, but in any scenario, each exhalation needs to be slow while inhalation needs to be quick, and the stretch conducted through the entire exhalation and pressure released only when there is no air left in the lungs. That allows to use exhalation to reinforce effectiveness of the stretch. Thank you, Julia, for help.
You're welcome.
These 2 simple stretches and 2 variants of the flexion stretch allows therapists to use homework by the patient as integrative part of the somatic rehabilitation and decompress knee joint and prevent further deterioration of the cartilage. These simple stretches, after the therapy is done and there is no pain, no dysfunction, patient needs to do these stretches 1 time per day after hot shower. While the therapist and the patient works together, these stretches need to be done frequently, every 2-3 hours, 5 repetitions of each. And they also need to be done after hot shower 2 times per day, in the morning and in the evening. This is foundation for the proper maintenance of the treatment plan and then prevention of the similar discomfort form in the future. Thank you for watching this video, and let's work together to bring your practice to the level of medical massage expertise. If you have any experiences or would like to leave comments, please do that. We'll appreciate your feedback, and we hope to see you in the future videos.